on my clock, so we're going to go ahead and get started. Caitlin or Kate, can you monitor the waiting room and let people in as they join?
Yes.
Okay, thank you very much. Hello, everyone. Daniel Silva here, President and CEO of the KCK Chamber of Commerce. Thank you for joining our webinar today featuring the United Way. We were doing a quick count earlier today. We reported to our board. We've hosted 10 webinars since the pandemic took place. You know, that's quite a few webinars, and we've done our best to try to be responsive to the needs of our members and really have tried to connect our members to the right resources and opportunities to connect to the right resources via webinars. Of course, we want to help all of our business members, all of our chamber members be successful and land on their feet and see this thing through. But we also think it's important for us to truly advocate for the community and those that are most vulnerable. And of course, as we all know, United Way has done such a great job for a number of years in really addressing the needs of those communities. I think now more than ever during this pandemic, as much as we need to take care of our own businesses and make sure that our doors are staying open, we need to absolutely unite as a complete community and ensure that the entire community is being looked after. As you know, oftentimes the most vulnerable communities are those that are most at risk. And I think we've seen the data that has proven that during this pandemic. So today is about learning more about what the United Way is up to. They've got some exciting news to share also. But also let's identify some ways that we can continue to stay engaged and involved and hopefully help United Way fill the big need that is currently taking place. So without further ado, I'm going to turn it over to Dr. Todd Jordan, President and CEO of United Way of Wyandotte County. Dr. Jordan.
Thank you, Daniel. Deeply appreciate you and the Chamber inviting me to present today. Certainly a unique time for all of us, but I'd also say that, you know, having adjusted to the new normal and really seeing, you know, how agencies, our local government, and a lot of our companies have all kind of come together and pitched in, it really just reminds me of how great of a community we have here in Wyandotte County and really across the Kansas City metropolitan region, because I know that there are a lot of other areas around the country that have a lot of difficulties as they've been forced to adapt quickly, and we've done a lot here that has been successful in trying to meet the quickly emerging needs and constantly changing needs that basically happened over the last 30 to 45 days. This is a great opportunity, and give me a second here to get my screen shared and we'll kind of get rolling. One of the things that we're going to kind of talk about today, and I'd remind you, you know, if you're not on mute yet, please make sure you mute yourself. And we'll kind of keep moving, you know, throughout the conversation. I'll offer a couple of opportunities for people to ask questions. And then also, you know, we'll have questions available in the chat feature that Daniel's going to be monitoring. So, you know, you'll have your ability to kind of chime in. One of the things I'm going to go over real briefly is just sort of the overview of what the United Way is and how the United Way functions. Then we'll kind of move into how COVID-19 has impacted the nonprofit sector, and particularly what the response and as well as the recovery efforts are looking like. And then I'll give you a little bit of an update on some of the big developments that have happened this week with the United Way of Wyandotte County. Just as, you know, a real high-level overview, United Way of Wyandotte County is one of 1,100 United Ways operating in America, 1,800 United Ways that operate in 41 countries and territories around the world. We're governed by United Way Worldwide, which serves as the umbrella organization for United Ways. They provide our membership guidelines, which determine our fundraising footprint, i.e. the zip codes we fundraise in, which right now is Wyandotte County, hence that's why we're the United Way of Wyandotte County. They also provide training, brand resources, and partnerships with national and international companies. We primarily raise resources by fundraising through the corporate channel, which means we work with employers, help organize their employees to do internal fundraising campaigns through the payroll deduction or special events. And we also get corporate matches and contributions. And that makes up about $2 million of our $3 million budget. The rest tends to come from contracts for services, you know, or grants that help us operate programs. We also help facilitate volunteerism, special projects, and we really just increasingly try to be a year-round philanthropic partner for the employers that we serve. As you can kind of see, you know, our areas that we cover are health, education, and financial stability from the brand credo that's on the slide. For United Way, the whole heart of the mission is understanding that you have to have an organization that kind of takes the big picture approach, that gets the community engaged in decision-making around where grants can go and how funding should operate and how to do programs and services, but we also know that, there's nothing in one part of the community you can really deal with without making everything else move. You can't really deal with health without dealing with education and financial stability. You can't deal with financial stability without dealing with education and health, and you can't deal with education without talking about health and financial stability. So it's really a complex process and organization, and it's part of the reason why I love what I do. We as United Way of Wyandotte County work with 34 partner agencies and serve over 50 programs, largely based on the funding resources that I kind of already discussed. And we support everything from emergency assistance, workforce development, childcare, mental health programming, after school, healthcare, and so much more. We work with employers of all different kinds, from the University of Kansas Health System, General Motors Fairfax Plan, the Board of Public Utilities, but also, some of our other businesses and employers in the community, Burke Travel, Burkle Construction, Kansas City, Kansas Public School District, the University of Kansas Med Center. We're really an organization that tries to find ways that we can help any employer in the area look at a way to give back. The thing that's kind of interesting and something that may not always dawn on, folks who are in the private sector or on businesses is that nonprofits, sadly, are employers just like everybody else. And as COVID-19 unfurled, we were disrupted just like everybody else. We had to move a lot of our staff remotely, we had, staff members who themselves maybe had health issues or fell into high-risk categories that could not come in. We were just as worried about payroll as anybody else was, how we navigate the changes to benefits that were kind of handed down. So a lot of our, area nonprofits really had to deal with, just the very same things that almost any small business would. And that really created a significant impact because this was also a time when a lot of people in our community were turning towards us to meet the various needs that were emerging. And I'll talk a little bit about a couple of key examples here in a second. But almost every organization had to radically alter their service delivery. And because it's, for us as United Way, the best thing we do is mobilize people to come together to meet a challenge. But how do you really do that when you can't mobilize and bring people together? If it was an element of trying to, fill sandbags because the levee's about to break, we could get people out to do that. If it was an element of put together a big mass feeding operation where we need 50 volunteers to pack food and put it out there, we could easily have done that, except in times when, you don't have PPE and there's no real safety protocols in place. So it really required a lot of organizations as they do mentoring programs, tutoring programs, legal services. They had to really reorient their service delivery. And a lot of them have been able to do that and continue to try and meet the needs of people in the community. From the funder side of things, because we also provide, direct support to our programs and agencies, and also we connect with a lot of our foundation colleagues, there were hard questions we initially faced of, do we continue to fund what we're funding right now? Because some organizations don't have the ability to necessarily fund what they're trying to do. There's some organizations that don't have the ability to fund what they had typically funded before. They're not going to be able to deliver programs as they used to. We had to be able to offer flexibility to agencies to meet immediate needs, especially before the payroll protection program rolled out. And then, how do you kind of deal with like changes and outputs and outcomes that maybe are coming from programs that have been disrupted? So I'm really proud that the philanthropic community in Kansas City stepped up fairly quickly and, worked to, in some cases where they were able, prepay their grants, or in other instances work with agencies in order to support what they were able to do in terms of, meeting the immediate needs, even if that meant changing grant parameters very quickly. Because that really helped give a lot of stability to programs as they were trying to, basically deal with what was the emerging COVID related issues. So a couple of key areas where we had to access immediate, needs and where they were immediately under demand were obviously the healthcare system. This is obviously not the expansive list of all the even, the healthcare providers in the area. I didn't put the major hospitals. I wanted to talk about the low-income safety net clinics, Vibrant Health, Duchesne Clinic, as well as Wyandotte Behavioral Health Network, which are just a few that still had to provide their basic services because there were still people who were sick, even without having COVID-19 that needed access to healthcare. But then these were also, in some instances, the very front line in terms of service delivery for people who, maybe had symptoms that were showing up, they were coming in. And so they had to radically and quickly reorient their work. And in particular, some of the organizations like Vibrant has been involved in some of the pop-up testing sites here in Wyandotte County to try and provide different ways of getting people access to COVID-19 testing as available. But really our, healthcare, low-income safety net clinics did a phenomenal job so far of trying to help make sure that they can access, get people access to health services. And a lot of that right now is resembling telemedicine as a first point of intake, but that's really what's necessary to keep both the population as well as the staff of these operations safe. Let's see here. The other immediate need, and I think this is probably no secret to anybody, was food pantries and mass feeding operations. Particularly when the school districts were closed down, that was a primary food source for a lot of different people and a lot of different students, but it's also for families within the area. And there was just a huge influx of demand, particularly as businesses shut down and their organizations, and they basically were losing paychecks, that people had to have access to food. So, here's a short list of some of the organizations that did a phenomenal job of retooling their operations. They faced some interesting challenges. Obviously, when there was the rush on the grocery stores, as people started to see that shelter in place was coming and that this pandemic was serious, that meant that donations dried up. There also were challenges, and I'd spoken to harvesters early on around just even getting access, if they had dollars, to a sufficient amount of food when they tried to do purchases, just because there were issues with the supply chain. And these are still issues that are ongoing. Certainly donating to your local food pantries as well as food banks is critical. I don't think it's quite as significant in terms of like, oh, we don't know where this is going to come from as it was maybe a few weeks ago, but there still is an overwhelming consistent need for food pantries to get support. And they also have to be able to deliver this food to individuals and to families without having any sort of like issues of spreading potentially COVID-19 to the families that are coming in or getting their own staff or volunteers infected. So it's a really terrifying kind of logistical challenge, but one that we had a lot of great people in our community meet. One resource that I want to highlight is the Unified Government Health Department's website. And I have the longer link to it right here. But if you kind of go into a search engine and type, Unified Government Health Department, it'll take you to their main webpage, and they have a big COVID-19 resource website that you can link to. And that COVID-19 site has a lot of different information on it, including, different resources. We help put together a resource guide that people can reach out to. And then there's also some different elements. There's a self-diagnosis test, and you can call in if you think you're having symptoms but aren't quite sure yet, so that you can get in contact with a trained health volunteer who can kind of walk you through some of their initial assessment processes. There's also information on the pop-up testing sites, as well as some of the other drive-up testing site that was launched this week in the UG Health Department's parking lot. It's, I think, Monday through Friday, 1 to 5 p.m. No appointment needed, but you do have to have symptoms. And the UG Health Department also has launched a health equity task force that's exploring a lot of the data around the COVID-19 infection and mortality rates. And sadly, one of the things that they're seeing initially, even though the state of Kansas is having a lot of challenges getting sufficient testing, is that we're starting to see demographic trends emerge with individuals who are infected and who are experiencing mortality that we've seen in a lot of our other communities across the United States. There's a report from the Kaiser Family Foundation that was issued a couple weeks ago called Communities of Color at Higher Risk for Health and Economic Challenges Due to COVID-19. And it pretty clearly calls out in several different states data around increased risk of people of color from having serious illness, becoming infected with coronavirus due to higher rates of certain underlying health conditions. Also, communities of color facing increased challenges accessing COVID-19 related testing and treatment, since they are more likely to be underinsured and face barriers in accessing care. And that their communities of color are also facing increased financial and health risks associated with COVID-19 due to social and economic circumstances. We're a highly diverse community in Wyandotte County. We'll kind of wait to see as the data emerges, and I trust the health department to provide this analysis, but it would not be surprising to me if those trends continue to appear. The more information that we get here in Wyandotte County, all the more reason why the response of our community to these challenges has to be significant. And I'm going to talk a little bit more about that here in a second. The thing that everyone needs to kind of remember is that, nothing that we were dealing with has gone away just because COVID-19 happening. Like, we still have the same problems we're dealing with in health, education, and financial stability. And many of these challenges have in fact been exacerbated. Individuals who were diabetic before COVID-19 are still diabetic. If they were accessing one-on-one counseling or small group classes to reorient, maybe their diet or to work on, their health in other ways, like they're not able to get the same access to those classes. Domestic violence has certainly seen spikes around the country, and there's a lot of difficulty with understanding that not everybody has the ability to shelter in place in a space that is safe for them. And so how do we get those individuals access to resources? How can they be accessing shelters? And then how do we do all this in a world where we still know that we have to limit the amount of one-on-one or group contact that we have? Education's a particularly challenging area as well. We know that the schools are on shutdown and that they're doing their best to transition to online learning. But we also have a lot of alternative education programs that are going on. We as United Way operate the Youth Build KCK program. which works with at-risk 16 to 24-year-old young adults who maybe have not made it through high school. They work on getting their GED as well as construction training. And I can just tell you that the isolation from the program, the forced to being sheltering in place, the lack of connection to what something they were working on to turn their life around, aside from slowing their progress, has had very significant mental health ramifications for them. And this is something that our staff has really just had to ramp up their increased focus. And fortunately, we have a lot of great partners in the community that we've been able to work with. But these are serious issues that are going on that, are going to continue to linger long after, maybe shelter in place has ended. The last point I'll talk on is childcare. Obviously, having childcare, facilities open is critical. That's the ability for people to be able to have a safe place for their kids to go while they're maybe working. We already faced a shortage of childcare within Wyandotte County, and we knew that part of the problem we were going to have after this now is that even as sites are able to open up, they may not be able to take back all the same number of kids that they had, as there are different requirements around how many kids can be in a facility. So we're really worried that we already had a gap in terms of the number of spaces we needed, and that gap may be amplified by the fact that not all of our childcare facilities may make it and reopen, but if they do, they may not be able to support even the same number of kids they had beforehand. So the ability for the community to respond to these challenges that existed prior to COVID-19, plus what we're dealing with COVID-19, is significant. I'm going to talk about some of the things you can do. If you do need resources, you can call 211. That is the Metro-wide number for United Way that will provide you to whatever your particular needs are and can kind of give you resources that might be in your area, or maybe resources for your friends or family that you might want to be able to direct them to. So the COVID-19 recovery efforts are kind of our next big challenge. The massive economic impact is going to mean that there's going to be a long-term need for assistance in a lot of different programs. I have to give a lot of credit to the Board of Public Utilities. We, provide a huge portion of utility assistance to the community, in large part funded by the Board of Public Utilities. They were very proactive early on in understanding they were going to have to stop the disconnection process. But they also understand that, as people have been economically displaced, there's going to have to be a significant need to slowly roll back or start the disconnection process again when things resume normal, because there's a lot of households that are going to be able to pay their bills. And to give you some idea of the scope, based on some of the initial data I've seen, there's somewhere between 5,000 to 5,500 households that are eligible for disconnect right now. And you're talking about, millions of dollars to ultimately wind up need to clear those bills. And the nonprofit sector can't cover all of that, but there's certainly a lot that we can do if we can get some coordination and collaboration, as well as some additional resources in place. But that's just one example of the economic displacement that's going to occur and what we're going to have to do in order to just make a dent in that problem. I believe, similar to what Danny was talking about a second ago, support to private and nonprofit sectors will be critical. There's a lot of different ways in which we can look to, I think, communities that have had major catastrophes, such as Houston or New Orleans with various hurricanes, and how they recovered and helped support their small businesses, either with, loans to keep them through, to help sustain them while they were trying to rebuild, or new startup models so that we can get employers, new businesses opened. The real challenge is going to be that testing is absolutely critical as we attempt to come out of shelter in place. And if we don't have sufficient testing, it'll be really difficult for us to manage the opening up process. There was a report from KCUR on Monday. The Kansas News Service had compiled data from the COVID tracking project, and the state of Kansas had the lowest testing rate among the 50 states. And that just simply makes it incredibly difficult for us to safely open back up our spaces. So we know we have to get the economy re-going. I know it just as much as everybody else, but there has to be a way that we do it safely. And I know that we're going to need to continue to support the nonprofit sector as well as our business community, because honestly, everything gets so much easier for us when we talk about service delivery if people have like a stable source of income and employment. And we still have to address a lot of these challenges that occurred prior to COVID-19. I'll kind of get into, I already talked about some of the social issues, but for those of you, since a lot of you, either on your company or individually are involved in nonprofits, you can kind of see how this is going to go when it's going to be really difficult for fundraisers, given that a lot of people have already been giving money to support COVID-19 recovery efforts, which is critical. So that means that's dollars down the road that might not be there, but there's also a different model of fundraising that's going to have to emerge. I mean, how do you do large events where you typically had, these, big silent auctions and, in-person auctions and all of these things that were used to be so common, and how can you plan on doing those not only over the summer, but even next fall, particularly with the potential for a second wave or microwaves to emerge. So it's going to be a very tough time for a lot of the agencies that people are relying on now to continue to raise the kind of support that they used to get over the coming months. There's also some business as normal that we need to continue to address. And the one that I'm going to highlight the most is just the census. We've been working on a lot of different census outreach efforts because this is census time right now. And the census is absolutely critical because it's one of the ways in which a lot of money that flows into the state of Kansas from the federal government gets calculated. It's also critical when it comes to, districting for different elections. And I believe the report that I have from Monday from Mike Grimm, who's in the research division at the Unified Government, is that the census response rate for the U.S. is about 50.5%. In Kansas, it's actually pretty good, about 55.2%. But in WyCo, we're at about 45.7%. And so getting people counted, getting an accurate count is absolutely essential to making sure we get every dollar that we're entitled to. I know that as we kind of adjust to see, there's been some delays in terms of, and some extension of deadlines, but we're going to have to all kind of come together as United Way, as nonprofits, as chamber and businesses to really make sure that we're doing everything we can to promote people in taking the census, filling out, completing the census, and then ultimately messaging with them that, you need to be doing this. If you're afraid of somebody coming and knocking on the door, the one way in which you stop people from doing that is making sure you can fill it out online. We have a lot of resources we've put together that we can distribute through some other channels, but this is just kind of one of those ways I wanted to mention that there's a lot of different things we need to kind of keep in mind, because while we do have COVID-19 on the front burner, there's so many other things that are important to our community that we need to continue to address. I guess I kind of pause right there and see if anybody wants to unmute and ask a question, or Danny, if you have anything that's come across the chat line that you think I need to be asked, I'll give you all a second here.
Yeah, I have a few questions that I have, but before I do that, I see that we have Senator Pat Petty is on the call with us today. She's been very supportive and very participatory on our webinars. Senator Petty, would you like to offer some thoughts from the legislative standpoint?
Am I on now?
Yes.
Okay. Sure. And thank you so much for this opportunity to listen to from the United Way's perspective. I think it's absolutely correct. We're a community that's going to be so dependent on, or looking forward to that kind of assistance. And there's going to be so many requests out there that it will be hard to meet them. From a legislative perspective, the LCC met today, and they are going to meet again before May the 6th. We will not be going back on the 27th, but they're going to be before May the 6th to determine when we will be going back. Of course, we have to go back. If we're going to go back, we have to go back for the 21st of May, because 21st of May is Sonny's Die. So that's just a little bit of that update. It's kind of hard to say from a legislative perspective. I was really concerned about the child care piece, because I know that in order for, just like many others, in order for those businesses to get any assistance, they have to be licensed. And if they're not licensed, then they're not getting assistance, and they can't reach out for any of those loans. And so this might be an opportunity to reach out to those child care providers to assist them to get licensed so that they can be meeting that kind of criteria. I just wrote a note to myself. I don't know if it's possible to have that, make that occur within the time frame to apply for some sort of assistance, but that's certainly worth thinking about. I really don't have anything else to say from the legislative perspective. I think there's so many things that are out there. I know I'm on the Early Learning Caucus, and we're going to meet next week just to talk about what other states are doing from a early learning perspective and that arena, and to just do some brainstorming. So, I mean, we're going to meet virtually. So, because I think we need to start thinking about what opportunities there are right now to take advantage of either programs that we right now legislatively don't have the opportunity to do because of legislation that we put in place that maybe now needs to change. Like we had changed the number of weeks for unemployment to 26 this year before actually the federal government then said 26, but we had, so we need to look at some of those roadblocks that we in the past put in place that maybe that we need to rethink so that we can help out in the areas that our citizens are going to be so vital to businesses and our citizens. So thanks for asking me.
Thank you, Senator Petty. Dr. Jordan, my question, and I think I know the answer to this, but I think I want the folks on the call to really understand, the need here. Given that there's a stay-in-place order, folks are working remotely. How much more stress is this putting on our service providers, during this pandemic to actually deliver services when there are other restrictions in terms of what you can and cannot do?
I mean, a massive amount of stress, and you're entirely accurate. That's a fair point. You've got all the normal things that we're all kind of experiencing with it being a global pandemic that none of us have ever been through, with this level of isolation that's occurring. The psychological impact is significant. But then also the fact that there is the same demand that's on them to come in and show up to work, to be able to provide necessary resources to people, and to do it in a way in which, they don't know if they might themselves wind up being infected. And, I think while there still is the hesitancy, or there still is, concern that if you have underlying health issues, you're falling into that high risk group. I think, there's been enough examples across the country that, you don't necessarily have to be in the high risk group to get COVID-19 and then also have very serious, potentially fatal complications. And these are things that I think weigh on all of us. And, nobody has surfaced anything where, you've seen the anecdotal evidence of people screaming at grocery store clerks because they're frustrated and, how can you yell at those people? And it's, but I can't imagine that has probably also been happening, particularly across the metro, just because that's inevitable when you look at the number of people that are being helped. So I hate to say, if you're in need of services, please remind folks to be kind and be patient, that we're doing the best we can with a very tough and tight situation where everybody is under a lot of stress and strain. But again, I think it really speaks to the quality of people that we have here within the community, not only in Wyandotte County, but across the metro, that we've had a lot of agencies that have said, we know that this could have been a time when we could have shut it all down and been reasonable in doing so, but we're going to find a way to innovate our programs and do what we need to still continue to do. And this is across the whole spectrum of services, kind of that I mentioned earlier, and try and make sure that people are in need get access to things that they're going to need in order to take care of themselves and their families.
Thank you. Any other questions for Dr. Jordan at this point?
Well, we can keep moving on here, because what I wanted to really talk about was also a little bit of what you can do to help. There are still volunteer opportunities available, and there's a couple of different resources that we can point you to. You can also, and I've put the contact information for Kathy Honor, our Director of Volunteer Engagement, on this slide. If you or individuals in your business are interested in trying to find a volunteer opportunity, we can more than certainly connect you with that. And there are some other resources, both locally as well as via the UG Health Department's website, as well as through the Greater Kansas City volunteer database that's on the Greater Kansas City website. We're also looking for donated products. And this may be things that we could immediately use now. I know that I'm pretty sure everyone on this call knows that, people need PPE. And if you have any PPE anywhere, hopefully you have been able to find a way to free up your supply and donate some. If not, I know that that's still necessary. But as we continue throughout the next few months, donations to the local food pantries, cleaning supplies, anything that you can access personally when you decide to go to the grocery store and pick up a few extra things that you want to throw in, or if you have the ability to access anything through your supply chain, connect with us. We can try and see if we can find a place in order to get it out there in the community. The other thing that is a really critical key effort that I wanted to talk a little bit about is the COVID-19 Regional Relief and Recovery Fund. And there's a couple different ways to give as part of this fund. The fund was established as a partnership of Mark, Greater Kansas City WISC, the Greater Kansas City Community Foundation, and United Way of Greater Kansas City. And they brought in ourselves, as well as a lot of other funders in the area, to create a recovery fund that would serve the entire metropolitan area. You have the ability to give, and you can give via our website. If you go to our website and click on the first page, you can give towards the fund. And I've put Gina McCord, our Director of Resource Development's contact information there if you're interested in making a gift. But the thing about the Regional Recovery Fund is that there was an initial seed money of about $1 million put in by United Way of Greater Kansas City with the Greater Kansas City Community Foundation. But then the Hall and Sunderland Foundation also came in with a fairly significant amount of gifts in order to create matching dollar amounts. And the original goal was to raise $10 million. And I believe right now we're hovering at about $16.5 million. Last week on Thursday, there was the 1KC drive, and that 1KC drive raised about $1 million in and of itself, and it accessed that matching amount for another $1 million. And, I know I've seen a couple people on the call who are in fundraising themselves, but, raising $1 million in a day is really difficult, and it's impressive and amazing that Kansas City came together. The Regional Relief Fund has been already outstanding and moved fairly quickly at getting money out into nonprofits. Wyandotte County does have representation on the advisory board from a few different people in our community. And the first round of grants, I believe they did 2.6 million to 55 or 56 agencies. Sorry, I don't remember which one. But there were multiple Wyandotte County agencies, as well as several agencies that serve Wyandotte County as part of their whole metro footprint that were included in that. So it's a great resource that's been able to really quickly get money out there into the community. From the application side, it's fairly easy for our nonprofits to apply to say, hey, here's what we need to keep going in terms of delivering services and maintaining operations. It's not the cumbersome process, and it's really been a wonderful effort on the part of the entire metropolitan area, and has really raised far more money than probably any one organization or even small collective groups of organizations could have raised by themselves. So there's a lot of different ways for individuals in the business community, both immediately, but then as, maybe things start to move back into normal and people kind of come back into the workplace, the ability to put together drives in your own workplace to collect, food for food pantries, we're happy to help facilitate that. If there are projects that you think you'd like to be interested in, we're happy to work with you and kind of talk about what we can do to get you active, engaged, and involved. There's nothing that's too small. There's a lot of different ways that we can all make a significant difference in the community, but it just takes, your willingness to reach out and say, yeah, we're interested in trying to get something together, and then you talk to us and we try and see what we can put together as a package. Like I said, I think it really is going to take everybody, both individuals and companies, doing everything they can over the next few months for us to make sure that, our area nonprofits have the ability to meet the needs that are out there in the community. But we've got this all organized fairly quickly and the response has been overwhelming. So I couldn't say how proud I am to, live here in Kansas City. I guess I'd stop again real quickly to see if anybody had any specific questions on the Regional Relief and Recovery Fund.
This is Senator Petty again, and I just wanted to ask, I think I do know the answer to this, but for those organizations that applied the first round on that for regional relief funds and weren't didn't receive a grant, they don't have to reapply, do they? Is that are their applications already still in place?
Their applications are in place. I believe there was something in the area of 400 applications on the first round. And so I know they're trying to do it in waves. And so, I don't believe they have to reapply. It may not be a bad idea to check back in to see if there was something in the application that was missing, and to also look at and kind of assess and maybe update the application if necessary to say, I know a lot of people were initially thinking, hey, I just need money to cover, payroll and operating expenses. And, if they were able to get a loan through the payroll protection program, then they might not have that need anymore. And instead, maybe they could shift their request into different dollars. So never a bad idea to constantly be communicating with the funder, particularly if you're not in the first group. But as you can imagine with, I think, what is it? There's either 11 or 13,000 nonprofits in the Kansas City metropolitan area. If there's 400 applications and there's only, even at $16 million, like, there's just not going to be enough money available. Like, that's kind of the harder part of what we're dealing with here. But I would encourage everybody to apply and to stay up on your application and communication with the relief fund to try and see if you weren't in the first round, if you have the potential to be in the second round, or update your application to make yourself more competitive. Good question, though. Thank you, Senator Petty.
You're welcome.
Is there anything else? Daniel, did something pop up in the chat box, or do I need to kind of push on?
Yes, Teresa McGarry is asking, how can we update the application?
That would be a contact. If you want to get a hold of me outside of this, I can connect you with the folks who are doing the application. That would probably be a contact through the Regional Relief Fund, like the actual portal. So usually, I believe Denise St. Olmer is the point of contact. But I tell you what, if you want to get a hold of me and shoot me an email off of that, then I can go ahead and talk to you. I believe Melissa Bynum's raising her hand right now.
Oh, great.
Oh, thanks. I just wanted to point out that the Unified Governments Casino Grant application deadline date got moved to May 1. So that application is also available through the online search at Greater Kansas City Community Foundation, and Wyandotte County 501c3 nonprofits might want to, have a look at that as well. Of course, with the closure of Schlitterbahn Vacation Village, that fund will not have those dollars. The total amount of dollars available is lowered this year, but nonetheless, we're going to allocate about $440,000 in casino grant funds. Applications due May 1, and I believe that we will allocate the money by sometime in July.
Yeah, that's a fair point. There are other funding pools out there, and we're probably going to need every dollar. So, okay. Well, that kind of wraps up the comments I had on the impact of COVID-19 and the regional relief work. There's one other update I wanted to share with folks here, and this is a fairly significant one for us. Maybe you had seen the press releases earlier this week, but I am happy to announce that the United Way of Wyandotte County has unanimously approved a merger agreement with the United Way of Greater Kansas City. To kind of take you back to the initial part of, the discussion here, we are one of 1,100 United Ways operating across the country, and we have been part of, the metropolitan area, but Greater Kansas City currently serves the Kansas City, Missouri side, as well as Johnson County in Kansas. And, as we as an organization have really looked at the changing nature of the philanthropic landscape, and in particular that United Way doesn't operate the same way that it used to back in the 70s, 80s, and 90s, which would have been our glory day, that there's a lot of different, there's an increased competition, there's a changing expectation from companies on what we want to provide, there's a changing, increased expectation from donors on what they want to see, that we had to be really honest with ourselves that we're going to have to look at some ways of thinking and acting differently if we want to serve the community as we can. And so we really started a process about a year and a half ago where we had some very hard strategic discussions around what kind of model do we embrace? Do we go to a single issue focus? Do we go to a pure fundraising focus? And the thing that we kind of kept coming back to is that sitting down with United Way of Greater Kansas City made the most sense to discuss what a combination and merger would look like. Largely because of the live work pattern of individuals in our communities, the scope and scale of the resources that we would be able to provide as part of a combined organization, the efficiencies that could be found by not having to pay for redundant backhouse services, and the fact that we also really had time because we weren't in dire straits, that we could really come into the organization as equals and have a discussion about what a combination would look like. And fortunately for us, Greater Kansas City were absolutely outstanding as partners in this dialogue. And so we had about a year-long conversation with board and staff-led committees around program integration, operations, governance, and to try and figure out if we operated the same as United Ways, and that also if we were going to be able to merge and successfully combine our operations. And I'm happy to say our board did unanimously approve the agreement. It is effective July 1. We got basically 95% of the way there before COVID-19 hit, and then we decided to press through because we knew that the challenges that were to come over the next year were going to be something that we really needed to meet together. The things that are probably most important for folks that are on this call are going to be the following. We have a guarantee to maintain our physical presence within Wyandotte County, both the office space that we occupy, as well as staff to match that so that it's not just a storefront where it's empty, but is also still the same thing that you'd expect from United Way, people being out there serving on various committees and working in the community. We are going to be able to offer all our staff comparable positions within the new organization. We have multiple board member positions that'll come into the new organization, including 4 spots for up to 9 years on the Greater Kansas City Board of Trustees. And perhaps most importantly, the dollars from Wyandotte County still continue to fund programs within Wyandotte County. Our agency agreements that are, what we provide in funding to our partner agencies, which total about $725,000. We're honoring the 3rd year of our 3-year cycle, but then we're going to extend those agreements an additional 2 years as the floor for what we're going to be providing to agencies in our communities. We also have multiple programs that we operate, such as Youth Build, early childhood education work through Dolly Parton Imagination Education Library, Project Spark, as well as Start Young, and the emergency assistant programs we operate, utility assistance, as well as the BPU hardship assistance program that are all going to continue. So there's a lot of need within Wyandotte County. There's a commitment to continue to make sure that, you know, the dollars that we are able to raise are going to continue to fund programming here within Wyandotte County. There's the potential to leverage additional dollars from around the region in order to drive, you know, further growth of programming in Wyandotte County. And then there's the expansion of services that we're going to be able to offer to many of our companies. The donor circles, such as Women's United, the ability to leverage the digital services platform, the Salesforce Philanthropy Cloud that United Way Worldwide has worked in partnership with Salesforce to develop. It's a big change, and I certainly appreciate that. It's the sort of thing which I know can be scary to a lot of people, but it's come after a lot of work and a lot of effort to make sure Wyandotte County is represented in the new organization. And I believe the thing that's kind of, you know, the most supportive to me and impressive to me, not only is the success we've already had with the COVID Regional Relief Fund, but also just knowing that, you know, what we're going to face in the coming year over COVID-19 means that the workplace campaign won't look the same way that it's done ever before, and it already was changing. And the thing that we have to have is the best and brightest minds for people who want to work on United Way sitting around the same table. And that's the agreement that we've struck. And so I'm deeply appreciative to our board of directors, several of whom are on this call. I really appreciate the leadership of the United Way of Greater Kansas City Board of Trustees, as well as Brent Stewart, their CEO, because we really, after putting together this entire agreement, believe we've achieved a best step towards creating a best-in-class United Way for the entire Kansas City region. I know that's a lot of information to drop on people in a relatively quick amount of time. I'm more than happy to answer any questions now. I know I've reached out and spoken with several of you who are on this call over the past few weeks and past few months about it. But this was not a decision we entered into lightly, and it was a decision that we entered into knowing full well that we needed to make sure that we had kept what we needed in Wyandotte County protected, but also have the opportunity to get back on the front foot and grow what United Way could be, both in WyCo as well as in the Kansas City region. And that's what I believe we've achieved. So I'm happy to share this with the KCK Chamber in case you had not missed this or had not heard the announcement yet, but it's an exciting time. And we're really proud of the work that we've managed to accomplish. You're going to continue to accomplish. Part of our challenge is we still have to stay on the front foot when it comes to COVID-19 and responding to this change, but we're also going to be able to really do it together with a broader set of partners, and that's really what's going to be critical for us now and down the road.
Thank you, Dr. Jordan. We'll make sure to recirculate that press release to our members.
No problem.
We do have a question here from Teresa McGarry. During this time, is United Way considering lifting the requirement for nonprofits to be non-faith-based or have non-faith-based options for program in order for them to get funding assistance?
That's a good question, and I can certainly raise that with the board chair, who's the head of our agency relations committee. I will remind you that we do fund several organizations that, while they do not go out there, while they are what I would call faith-based to a certain extent, like Catholic Charities of Northeast Kansas, Metropolitan Lutheran Ministries. I mean, there are several organizations that have a strong faith component. I mean, we do also believe, you know, that we have set our guidelines in place regarding what we will and will not support for a reason. And that is honestly driven by the community volunteers who serve on our agency relations committees, as well as our board of directors. So I can certainly raise that question. And I guess if you have a more specific example, you can chat with me offline and we can kind of see what we can work out. But no, that's a fair point.
Any other questions for Dr. Jordan or comments?
There's no way I'm this thorough, but I appreciate everybody.
Sounds good, Dr. Jordan. I will just make a quick note, and Commissioner Bynum, you're aware of this as well. You know, the mayor has put together a restart WyCo task force that is chaired by Commissioner McKiernan and Dr. Grainer, and a couple of the business organizations and business owners and community stakeholders are part of this task force. You know, the conversations are already taking place in terms of what it can look like when we start to reopen businesses and offices and nonprofits. And so we are kind of in information gathering mode. So if you could just be thinking about, you know, what that would look like for you in your workplace, You know, we have a feeling that the different types of businesses and industries will have to open differently. And so if you can send that to me, Daniel at kckchamber.com, just some thoughts on what it would look like for you all to reopen your offices or your organizations or your businesses in a safe way that you know, really observes the social distancing piece and the different protocols that are in place from a health perspective. That input will be extremely valuable for us to relay back to the chairs and then on to the mayor and the commission as they look to come up with a solution. Dr. Jordan, any closing comments?
No, I just thank you all taking a little bit of time on a, you know, very hectic, on a very hectic week for all of us in a really wild time. I deeply appreciate the support of everybody all across the Wyandotte County community, and in particular across the metro. You know, we're in this together. We all have different needs and different demands and different challenges. And we've got to find a way to, you know, find the best path forward to help those of us that are, you know, in those businesses and those organizations that are suffering a great deal right now. We're very fortunate that we're still able to continue to operate and, you know, provide what we can provide out there into the community. And, you know, I know we have a lot of great nonprofits that are out there as well. But thank you very much to Daniel and the Chamber, because, you know, certainly providing these webinars and these information and keeping things rolling on a lot of different subjects is really essential right now and will continue to be over the next, you know, few weeks. And hopefully we can get back to some semblance of normal. So thank you, sir.
Sounds good. Thanks everyone for joining us. That concludes our program. Appreciate it. Be safe.